Welcome back to San Antonio Living. This morning we're talking about a topic that really is a little bit hard to discuss, especially for guys. Women, for whatever reason, we're totally okay talking about our breasts all the time. But today we're kind of switching the tables. We're talking about male breast enlargement because it's a very common problem that young boys have, also young men. And there is a simple way to fix it. So we have brought in Dr. Elizabeth Harris this morning to tell us a little bit more about male breast enlargement. And there's a word for it. It's a medical term, and I'm going to let you say it because it's hard.
Gynecomastia.
Okay, see, there we go. We've got that out. And, you know, I can imagine that men just cringe when they have to talk about stuff like this, but it's a common problem.
It's very common. It's very common during puberty, and then as men age, it also becomes increasingly common. But about 30 to 50% of men in their 30s and 40s have gynecomastia. That's very bothersome to them, and that's when they seek consultation with a plastic surgeon.
So if you're a young guy, you're going through puberty, and you've got an enlargement of the breast, it's something that could still go away, right?
Absolutely.
Okay.
And the best thing is to wait until the hormonal fluctuations subside. And at that point, when it doesn't go away, that's when you need to, seek medical attention.
Okay, and we've got a picture to show you so that you can kind of get an idea, because we're not talking about men having, like, breasts the size of women. It's just a small enlargement, similar to something like this that you see in the picture, that men are really uncomfortable with. And you know, if I was a man, I'd be uncomfortable with that too. So first of all, let's sort of explain how this happens to men. Is it hereditary?
It can be hereditary, but it can be caused by multiple different reasons.
Okay.
A lot of medications that men take, some of the blood pressure medications, prostate enlargement medications, prostate cancer medications. There's a very, very large list of different causes. And what happens is that the breast tissue is stimulated by the increased estrogen, which is caused by many different reasons, including the medications, as I mentioned.
Okay.
The glandular tissue here is what gets enlarged and proliferates. There's a type of breast enlargement called pseudo-gynecomastia, which is only the increase of fat, and that happens in obesity. With men that have these glandular elements, that's when surgical options need to be done where that is actually excised instead of just liposuctioned.
Okay, so let's talk about the options now, because a lot of guys are like, well, wait a minute, I need to have a surgery, because there's a couple of different options that you can go with. The first option is what? Liposuction?
Well, liposuction can be performed, and that's in outpatient surgery.
Okay.
And generally, if a patient has primarily fatty component to their breast, that's when we do that. And that's with very small incisions. We would make a small incision into different portions of the breast that would be hardly noticeable, and it definitely gives a very obvious change.
Okay.
With men that have more of the fibrous elements, we actually have to make a small incision at the base of the nipple. Again,
Okay.
a very well hidden incision, and that works very well in regard to going underneath into the breast tissue and removing some of the glandular elements that form because of the increased estrogens.
So I say it's somewhat a simple process. It's a little bit simpler than having, you know, an enlargement or a reduction in women.
Yes,
Okay.
but it can be a serious problem in regard to that. There are some men that can get very large breasts, mostly in the situations where obesity is present, and then after they lose the weight, they have a significant amount of hanging tissues. Then the scars would be much larger than what we have here.
Okay, so this is a situation that can happen to guys that are overweight, but also guys that aren't overweight, right?
Absolutely.
Okay.
And one of the worrisome ones is anabolic steroids, men
Right.
that are taking steroids for bodybuilding. And those steroids can be converted to estrogen in the body and can stimulate the breast. And that actually doesn't go away with the liposuction. It requires a little bit more aggressive surgery to remove it.
Girls often run into this problem where we exercise and exercise and exercise, and we still have the flab, and that's when we turn to doctors. And is this something for the guys? It's the same situation. They're doing all their weightlifting and they're still having that fat around their breasts?
Well, our fat components are genetically predetermined, and so there are some men that have genetically predisposed fat collections around their breast. But the good news is that can be taken care of with smaller incisions and liposuction.
If we have some guys at home that are watching right now and they've got something like this going on with their bodies, what would you encourage them to do?
If it really is bothersome to the patients that are in that type of a situation, and they can't wear certain clothing, they don't want to go to a pool without a shirt, come and seek a plastic surgical evaluation to find out if they're a candidate. They will need to get a thorough screening. They will need to have a testicular exam because there are some testicular cancers that can cause this and more serious findings.
So it could be a serious problem. It could be a cosmetic issue. Either way, you need to get some answers.
Absolutely.
All right. Thank you so much for coming by today. Appreciate it. If you would like to get more information about Dr. Elizabeth Harris, you can find her at the Center for Cosmetic Surgery out on Madison Oak. Here's the phone number. It's 545-4848. And you can find out more about what Dr. Harris does for both men and women by checking her website. It's eharrismd.com.